Visual action therapy is a nonverbal intervention used for patients with global aphasia. It is aimed to increase their communication by producing symbolic gestures. That is accomplished through a hierarchical approach with 3 different levels. Level 1 has 12 total steps. Level 2 is steps 6 through 12 from the previous level, just using different stimuli. Level 3 is also a repetition of steps 6 through 12 from level 1. Scoring. A perfect score is 5, and a total of 4.5 needs to be achieved before moving on to level 2 and 3. Average treatment time is 4 to 14 weeks. In step 1, the clinician will arrange the picture cards in a random order in front of the client. The clinician will then give a single object to the client and indicate the client to match the object to the picture card. In step 2, the clinician will arrange the objects in front of the client. The clinician will then give the picture card to the client and indicate the client to match the picture card with the object. In step 3, the clinician will arrange the objects in front of the client. The clinician will then hold up a picture card to the client and indicate the client to point to the correct object. In step 4, the clinician will arrange the picture cards in front of the client. The clinician will then hold up an object and indicate the client to point to the match of the object. In step 5, the clinician will point to the card and pick up the object and demonstrate the function of that object. This item is not scored for the client, and the client does not have to respond. In step 6, the clinician will arrange the objects in front of the client. The clinician will then show the client a picture of the object and indicate the client to pick up the object and demonstrate the function. In step 7, the clinician will put an object in front of the client's visual field. The clinician will then demonstrate the gesture that's most commonly associated with this object. The client is not supposed to respond for this portion and is not scored on it. In step 8, the clinician will place the objects in front of the client. The clinician will then give a gesture for each object and encourage the client to point to the correct object. In step 9, the clinician will place an object in front of the client. The client will then give the correct gesture for this object. In step 10, the clinician will hold up the object in front of the client's viewing field and give the correct gesture for the object. In step 11, the clinician will put 2 objects in front of the client. The clinician will demonstrate the gesture for each object. The clinician will then hide both of the objects in a box. The clinician will then bring one object into the patient's viewing field. She will produce a questioning gesture and point to the box. And then she will produce the gesture associated with the hidden object. The patient is not required to respond for this portion and will not be scored. In step 12, the clinician will bring 2 objects in front of the client. She will indicate the client to give the correct gesture with both of the objects. The clinician will then hide both of the objects in a box. She will then bring one object into the client's viewing field. She will give a questioning gesture and point to the box, and have the client give the correct gesture for the hidden object.